We are here with Angelica from Paraguay. She's the head of monitoring and evaluation of the NTP and consultant for WHO, PAHO for epidemiological review TB. So Angelica, please go on. You have 15 minutes for your presentation. Thank you. Thank you so much for the introduction. Good morning, good afternoon, everybody. Now I'm going to talk about the innovation on public health, the role of AI in the detection of TB in Paraguay. Next slide, please. Next slide. Okay, so for you to have a context, Paraguay is in South America, and according to the last numbers that we got from 2020, we actually got this information 3 weeks ago. Paraguay has a population of 6 million inhabitants, and we can see here the cases of TB in Paraguay from 2000 to 2022. We can see how this number increased. Right now, it is believed that there are 3,500 cases. And these are the numbers, as I said, for this year. Next slide, please. Okay, when it comes to the incidence rate for TB, we can show here that 48 is the amount of people with TB every 100,000 inhabitants. And in 2022 used to be 43.6. You can see how the breach is closing starting from year 2015. In 2020, there is a drop, of course, in the number that has to do with the pandemic for COVID. And then we see how this number begins to increase again in 2021, and 2022 is one of the highest numbers in the last years. Next slide. This slide shows the information from the OMS. This is the draft for the TB profile in Paraguay. We are going to be able to see these in the global TB report from the OMS in the future. We can see that the incidence, which is this green light, we can see, and then you can see a black line, which is part from Paraguay. So as you can see, in 2020, the breach is almost closed. And then the difference that there is between this slide and the previous slide, the difference is that the OMS uses the estimated population from the UN when we actually use the estimated amount of people, inhabitants from national entities. Next slide, please. Next slide. Thank you. So you can see the distribution of the cases in Paraguay. On the left side, we have the map that you can get from our expert system, that it's the online system that we have to identify all of the TB cases in Paraguay. On the left, you can see Paraguay's map with the cases of TB. And on the right, we see the Paraguay map with the incidence, classified by very high or low. So as you can see in the Chaco area, which is Paraguay, and these areas in dark blue, the cases there are quite high. The incidence is very high. You can see that in the other map, there are not many cases on that area, but the reason why the incidence is high is because there's not a lot of population there. So that's why. So the incidence is higher even though the inhabitants is lower. This is where we have the larger amount of indigenous people. Next slide, please. This graphic, I would like to show you how the detection of cases increases. These are the blue bars. When we started using the GeneXpert chart, the fast tests that Paraguay has implemented as a first diagnosis. So every case that could be TB is offered this fast test. And we've been doing so since the end of 2021. So you can see in the picture how the number of cases increases in the last couple of years. Next slide. Next slide. Now we're going to see the characteristics of TB cases in 2022. We can say that 70% of all of the cases were bacteriologically confirmed, and then 81% of these cases were new. We have 99% of the cases are considered sensitive, and Paraguay has not a lot of cases that are resistant. And last year, we've only had 20 cases. So this is also taking into account that we have already implemented the GeneXpert as a diagnose. When it comes to the location of TB, 92% is pulmonary. Next slide. If we talk about TB and the problems it had in 2022, 10% of all of the TB cases, this means 3,500 cases, 10% of them were people who had HIV. 7% was people with diabetes. Next slide, please. Then when it comes to the risk population with TB in Paraguay, 12% of all of the cases happened in indigenous people. And as you can see, we have people also who suffer from addictions of smoke, other types of addictions as well, and people who live on the streets. Next slide, please. The characteristics of the population with TB in Paraguay when it comes to female and male. As it happens in everywhere else in the world, TB is a disease that mainly affects men and in the ages of 15 and 40. Next slide. These are some pictures of our populations. I mean, we already talked about this, right? We're talking about the people who live in jails and indigenous people. These are pictures from the prisons. Next slide, please. And then, to keep in mind, according to the regional report of the Pan American Association of Health for 2020, we have a list of countries according to the amount of TB they have in people in prison. So as you can see, Paraguay was in number 6 with a number of 2,400 cases every 100,000 inhabitants. This was for 2020. Next slide. Here we can also see, according to the case detection activities in prisons, we can see how the number of TB increases. And also our activities of looking for respiratory symptoms. You can see that this number increases. Next slide, please. So you can see the difference between the incidence that we have in people imprisoned, that is the blue line, like the one at the top, compared to the numbers in people who are not in prison, that is the light blue line. You can see the very large breach that there is between these two types of people and how this is a problem for Paraguay. As you can see, we closed 2022 with a total amount of 3,700 cases of people with TB in prisons and 43.6 people in cases of people who are not in prison. Next slide. And then to talk about the X-ray with the use of AI, it's very important to say that this is very useful because in areas where the tools and the resources are not many, we know that the conventional X-ray has limitations. And we also have the possibility of variability in the resources. So we also know that sometimes we don't even have access to people who can use these devices in some areas. So that's why AI automates and standardizes interpretation and complements healthcare workers. Also, the promise of CAD technology is to be useful with ultra-portable X-ray systems that extends detection to hard-to-reach populations. Next slide, please. And then, according to the NTB strategy, we have three main pillars. One of them is precisely about the intensification of the research and innovation. This is where we're talking about the use of X-rays with AI for the detection of TB at an early stage. Next slide, please. And then the WHO recommends the use of CAT for screening and triage. Next slide, please. Then in 2022, the WHO recommended the use of CAT software programs for everything that has to do with the detection of TB in early stages. Next slide, please. And then also to strengthen the efficiency of the diagnosis with the aid of digital X-ray with AI. This helps us to have an early detection. This gives us precise images, and we can also identify other types of problems that have to do with the lungs and the thorax, and also it provides accessibility. Next slide, please. And then we have Paraguay's experience. Here we have to say that from 2016 to 2021, Paraguay has been working in the active search of cases, which was done according to the clinic. So from September 2021, we started a project called Prenos. This project is led by EUSAC. It's an organization that is made of people from Portugal, Spain, and Paraguay. And this project was focused on Paraguay's prisons, especially the ones in the capital and in the center of the country. With this project, we reached more than 3,800 people who were tested for TB, and we used the digital X-ray with AI. Now, from May 2022, Paraguay started its experiences with X-rays, digitals, and then in January this year, Paraguay started using screenings with digital X-rays through Delft equipment. Next slide, please. Now for you to see the circuit sequence for active searches. This is very similar to what has already been mentioned by the colleagues in Peru and Colombia. This is the algorithm that was also applied in Paraguay. And for this, we did coordinations with the team together with regional people in charge to go to those communities that were far away and maybe people also who were in prisons and indigenous people. So, as I mentioned, we had to do some coordination with local teams. We talked to the people and invited them to participate in these activities. And with the circuit, the first thing we did was interviewing people to get their information. And after that, we presented the digital X-ray, what are the benefits, and asked them if they wanted to participate in that experience. Once they accepted, we had a score of 60 to be able to go to the sputum sample. So we can confirm or not TB. And then in other cases, whether it was necessary to have samples, and even though the X-ray showed everything was okay. Next slide, please. These are some pictures of how the team prepares to do the X-rays, how they look, how the images look. Next slide, please. And then these are the objectives that we had in this active search. That is to implement an active search strategy and capture of presumptive TB cases through the use of digital X-rays with artificial intelligence. We reached 5 health regions using this Delft equipment. We focused on key population and also in those places with a high number of TB. The team is made up mainly of people in the National Program for the Control of TB. Generally, they go to sanitary regions, to places that are far away, and we have 2 people. It's a group of 3 or 4 usually. Sometimes when we can, we also bring a doctor, and we coordinate this in the region so we can reach places that are very far away and that need of our assistance. Next slide, please. Then to talk about some of the results, as I mentioned, we start to use the Delft equipment this year, actually in January. So we're still working on this, on our database, right? And we want to adjust our database and do an analysis and, and share our experience. Then from January to July, we were able to test 500 and around 500 people. 101 had symptoms. 89 were examiners. And in total, there were 12 cases with TB. Next slide, please. If we talk about key population, we talk about the people in prison, indigenous, TB contact, people who suffer from diabetes, and people with history of previous treatment. In indigenous people, we analyzed 82 people. Sorry, we analyzed 288 people. 82 had some type of abnormality in the X-ray, and we confirmed 5 cases. In contacts, we've analyzed 37 people. 7 had no problems in the X-rays, and there were 2 confirmed TB cases. People who suffer from diabetes, we tested 39. 6 of them had normal X-rays, and we had 4 confirmed TB cases. We also saw people who suffered from TB before in the past. 20 of them were screened, 7 had no problems, and 2 were confirmed cases of TB. Next slide. And then for our next steps, the TB program acquire a TB mobile, and it's ready to be used. So we are going to be using this. That apart from the X-rays, is going to have a gene experts, so we can make sure that the case for TB is positive or not. Next slide. And then just finish with this. Paraguay has many challenges, of course, when it comes to TB, because we no longer have funds for this, for the TB. So we are working with the funds from the Ministry of Health only. And one of the challenges we have is this, the budget. We don't have enough money for it, all of the logistics of the TB. So we just need to make sure the maintenance, like maintenance of the equipment, we need to prioritize our efforts, strengthen healthcare, and we need to use X-rays and consolidate the screening tests on prisons. Thank you so much. Thank you for paying attention.